have to give my introduction also. Starting. Hi everyone, this is Dr. Sabha, working as a clinical cardiologist at Owners Hospital. So today topic is health checkups at the age of 40. First, our approach is to build and trust and make a connection with patients. We take the time to understand, explain every step clearly, and make you feel confident in our care service. As a cardiologist, early screening of heart disease, preventing heart attack and stroke, importance of lifestyle and medical evaluation is mandatory. So how we approach a patient who is turning as a 40 and how to evaluate from cardiac side. Cardiovascular risk begins to increase after 40. Silent diseases like hypertension and diabetes start appearing. Early atherosclerosis may already be present. So what screening is required? Screening should be focused on identifying high blood pressure, diabetes or prediabetes, high cholesterol, obesity and metabolic syndrome, smoking and alcohol use. Basic cardiac evaluation. Every individual at age 40 should undergo blood pressure monitoring, body mass index calculation, waist circumferences, and clinical cardiac examination. So body mass index is calculated, waist circumference is calculated, and patient is treated accordingly. Essential blood test. What blood test should we undergo to for early prevention? So fasting lipid profile, fasting blood sugar, HbA1c, kidney function test, thyroid function test, high sensitivity C-reactive protein. And for heart routine, what we go for is ECG, 2D echocardiography, and stress test or treadmill test for selected individuals. We prefer stress test for elderly and treadmill test for young individuals. Advanced screening for high risk individuals. Some people fall into a high risk category. So for that, we directly go for coronary artery calcium scoring CT scan, carotid Doppler for plaque detection, Holter monitoring for arrhythmias, and CT coronary angiography for selected cases. So lifestyle assessment is mandatory. Cardiology evaluation, when you are evaluating a patient for cardiology for cardiac diseases, we should send him up with lifestyle modifications. So for that, we need to do lifestyle assessment. Cardiac evaluation should include dietary habits, physical activity level, sleep quality, stress level, smoking and alcohol intake. Dietary habits, we should include more fiber, more protein in our diet, so there should be less sugar spike and you feel satiated and usually lose weight. Physical activity level, a minimum 30 minutes of daily activity, daily brisk walking or strength training is compulsory for every individual above 30. Sleep quality, a minimum 7 to 8 hours of sleep is essential for every individual. And smoking, there should be complete cessation of smoking and alcohol intake. So frequency of checkups, how many times you should get checked up in a month or yearly or 6 months once. Recommended screening intervals include for blood pressure, you have to check yearly, lipid profile every 1 to 3 years, diabetic screening and BP blood pressure screening yearly, ECG every 1 to 2 years. For prevention strategies, what I prefer is to reduce cardiac risk, cardiovascular risk. Exercise at least 150 minutes per week. Follow heart healthy diet that is low in cholesterol, low in triglyceride, less carbohydrate, more protein, maintain healthy weight, stop smoking, stop alcohol, control blood pressure, sugar, and cholesterol. This all lifestyle modifications will help you control your blood pressure, diabetes, and cholesterol, and eventually leads to a weight loss which is plus point for you in this journey. And if you feel some like warning signs, seek medical attention without hesitation. Like chest pain or heaviness, shortness of breath, palpitation, and explain fatigue, dizziness, or syncope. Early evaluation can prevent heart attacks and stroke. Thank you. This is recorded.